Hey everybody, this is Mr. Moffat coming at you again with another APGov video. This is our third video in the series focusing in on topic 4.10, ideology and social policy. Now, previously we talked about social welfare policy as it pertains to certain aspects of healthcare, be it Medicare for elderly Americans and Medicaid for poorer Americans. And we wrapped up by kind of introducing the rationale for what is going to become known as the Affordable Care Act, aka Obamacare. And remember, this was designed to try to address a number of healthcare issues affecting Americans, but especially those that were part of the working poor, who were not old enough for Medicare, not poor enough for Medicaid, didn't have an employer that provided health insurance. How do you help those folks? So, what we're going to take a look here at are some of the key provisions in the Affordable Care Act. Once again, it's a number of small provisions that come together under the umbrella of the ACA. So, one of the big key provisions is that now under the ACA, insurance companies cannot deny coverage to people with pre-existing conditions or have the use of what are known as benefit caps. Traditionally, you might be someone that wanted to have health insurance, but you would be denied if you had some sort of an expensive medical issue of some sort. Like let's say you were a diabetic and, insulin's expensive, a health insurance company might deny you coverage for that. Now they can't. In the past, they would have, benefit caps over a lifetime. They might have, like $1 million cap over the course of your lifetime in terms of what they would be paying out to help you medically. Well, what if you unfortunately have, cancer and health and chemotherapy treatments or radiation? That gets extremely expensive, and you would have people that could be cut off based on having the caps met. Well, now those are gone. Something else that is going to be significant is that prior to the ACA, if you were someone that was looking to buy health insurance on your own, individually, which you've always been legally allowed to do, rules applied that you had to buy health insurance that was located within your state. And that then limited your options. Well, what Obamacare does is break down those state boundaries and allow for what we call health exchanges that allows people to be able to basically shop around across state lines to look at health insurance policies that might be cheaper and more affordable, as opposed to being limited to what you have just in the state that you reside in. Something else that's going to be part of the ACA is expanding the amount of people that would qualify for Medicaid. So in other words, kind of reducing those standards to be able to qualify for Medicaid. Now note, this is a little bit tricky because, as we've said previously, Medicaid is a federal and state funded program. So the Medicaid portion that would expand it was not mandated under the law. It's not mandated under the ACA, but states were incentivized to do that, with the federal government forking over most of that funding for the first several years of expanding that Medicaid benefit. Most states did choose to expand the Medicaid eligibility, but not all. Some of your more conservative states chose not to do it out of a concern that, what happens if we expand Medicaid and then the federal government doesn't, provide the extra funding? State governments run on a tight budget already as it is. Could we actually swing that? So there was differences of opinion on that. In case you're wondering, Ohio did accept the Medicaid expansion. Something else that is now going to be part of mandatory parts of insurance policies are that, preventative treatments are now covered by insurance. So the idea being is, for example, getting a mammogram. We know that for women, getting a regular mammogram is important to, offset, breast cancer, or getting a colonoscopy after the age of 50 helps to offset, looking for colon cancer. So those things that may not have been covered by insurance in the past are now covered. Definitely one of the most popular aspects of the ACA, especially amongst, millennials and now getting into Gen Zers eventually, is the fact that now young people can stay on their parents' health insurance until they reach the age of 26. That's really, really significant because, we've seen over the last 20 years economic ups and downs. where people may not be able to, get health insurance on their own, but have parents that have it, and being able to have more time to stay on your parents' health insurance until you're able to access it for yourself. So this has been extremely popular. But note, there have been some more controversial aspects of the ACA. Perhaps the most controversial of all was what we call the individual mandate. Obamacare functions on the same premise that car insurance functions. In states like Ohio, you are required to purchase car insurance if you want to have a driver's license. The idea being is that everybody pays into the insurance, then there's funding to be able to provide benefits when people need it under the insurance program. Same general idea for Obamacare, but now we're talking on a national level with health care. So ACA mandated that if you were an adult, you had to have insurance. You had to have health insurance. Now, it could be from your parents if you're under 26, on your parents' health care plan. It could be from your employer, or you buy it yourself, maybe through the new expanded health exchanges, or maybe you now get health insurance because of expanded Medicaid or whatever. Every adult American had to have health insurance. And this was very controversial because, there were, imagine being somebody that was, 25 years of age, and you are young, you are healthy, you eat right, you take care of yourself, you don't engage in, things that would be, risky behavior for you physically. You might say, hey, why would I be forced to have to purchase this product? Why would I be forced to have this this policy that's going to cost me money? Because here's the thing. If you did not buy health insurance, then you would be taxed by the federal government, in essence, as a penalty. So the idea was this. Either you buy health insurance or you're going to be taxed to cover the funding for that. So this really did bristle a lot of conservatives in terms of, like, is this government overextension into your personal life? Is this, something that, violates our individual rights per se? The other, of course, controversial aspect of the ACA was the requirement that any business that had at least 50 people working for them, they must provide health insurance to employees. Remember, that is the number one source of where people get their health insurance from historically, is via their employer. And now if you are a business of 50 or more full-time employees, that employer now has to be able to provide health insurance for you. Now, you might look at that and go, oh, that's a great thing. More people are going to be able to get health insurance. And that might be the case. But what's controversial about this is that what if you are one of these businesses that's right at 50 employees or right at 60 employees? Health insurance is very expensive to buy for your employee. That's not a small cost. Now, if you are Walmart, if you are McDonald's, if you are Procter & Gamble with lots of money, you can afford that stuff. But if you are a small mom and pop business, that might be something that's a very, very big financial, pill to swallow. Not to sound punny with the healthcare jokes, but so what we've seen happen is that, in responses, we've seen some companies in an attempt to try to get around some of this, is reduce the number of full-time employees and have more part-time employees. And some have argued that that has created more problems for people because, instead of having a full-time job, now you have a part-time job potentially because your employer cannot afford to provide you health insurance, and they would have, potentially more than 50 full-time employees. So there's certainly controversy over that. Now, since the ACA's passage in 2010, the individual mandate has been repealed. That was repealed via the Tax Cuts and Jobs Act from 2017. This is, once again, President Trump's probably signature piece of legislation. So now today, the way the system works is that, it's just folks wanting health insurance that are going to be paying into it, not everybody that exists as an adult. which critics have argued if you take away that individual mandate, now you make it financially harder for insurance companies to make a profit. You make it harder now for this program to work out financially. So we'll see what the future of this holds in terms of this kind of an impact. We've also seen attempts via lawsuits to see the Affordable Care Act found unconstitutional, and those have failed. A few years ago, we saw that the Supreme Court, in a 5-4 ruling, and note, John Roberts, siding with the liberals on this, is going to rule that the ACA is constitutional. The idea being, for example, when you had the individual mandate still on the books, that it was a tax at the end of the day, and the federal government has the power to tax. A lot of this stuff fits into protections under regulating interstate commerce. So the ACA, though controversial, though highly unpopular in certain parts of America, is constitutional. However, we have seen legislation strip some of that away a little bit. So the future of the ACA is really interesting to see. One thing we have seen is that more support over the years has grown for the Affordable Care Act. And of course, if you really want to look at something funny, take a look at polling in terms of who supports the ACA versus those that support Obamacare. You see higher percentage of support for the ACA, lower support for Obamacare, which is of course hilarious because they're exactly the same thing. Politics, what are you going to do? Now, that being said, even though you've got, a number of social safety nets in place to try to help people, be it, for example, through health care, Social Security, etc., there's still a lot of debate in terms of, is this good enough or is this too much? Those on the far left, folks like Bernie Sanders, for example, and AOC, and, folks on that far left, they will look at some of these programs and they'll look at Medicare and they'll look at Medicaid and they'll look especially at the ACA and go, that's nice, but what we really need to have is a single-payer universal healthcare system, like most countries around the globe, where straight up the government pays for those services, period, end of story. Now, you've sometimes seen this promoted as quote-unquote Medicare for all, and that's kind of a politically driven thing. It's good marketing perhaps, with the idea being that Medicare is an extremely popular government program. Ask your grandparents, do they like Social Security? Do they like Medicare? They love that typically. And so the idea being is you take Medicare, which is already popular, and then you just expand it to everybody. Now, of course, there's, controversy with that. Will you get the same quality of health care on a universal system that you have versus what we have here right now? Would this be too much government expansion? Can we afford this? Those are all legitimate questions if you went in that direction. Now, on the far right, more on the conservative side for sure, there's the question of, are we doing too much? Do we need, in the name of trying to have a more balanced budget, limit the extent of these social welfare programs? Should we change the laws with some of these entitlement programs so that they, are less of a chunk of the overall budget? Should we make it tougher to qualify for things like Medicaid and stuff like that? So, at the end of the day, when we do talk about these social welfare policies, for the vast majority of people in America and in Congress, it's not a matter of do you have these programs or not for the most part. It's, yes, you're going to have these programs, but to what extent? How big? How expensive? Those kinds of things. That's really where the debate is. Liberals wanting more, conservatives wanting less. Okay? So we'll leave it there for now. We will see you next time.